So now we move on to the next award. The next award is the IT Executive of the Year in the Public Sector. And the winner of this award is Gary Gumbert. And Gary is the CIO of one of the largest health and human services agencies in the country. Gary joined HHSC in 2004 with the responsibility of transforming the HHS Health Services Citizen Interaction and Communication Model and modernize its AT application and infrastructure portfolio. He not only succeeded in this, he succeeded with great levels, because today he is the winner of the IT Executive of the Year in the Public Sector section. And presenting Gary's award will be Bobby Hoffman, the former Chief of Staff of HHSC and now the Deputy Executive Commissioner for Information Technology. Bobby? Thank you.
Well, I thought Mr. Gumbert was going to be rather shocked, but he didn't even jump when I came up behind him and put my hands on his shoulders. So, Mr. Gumbert, why don't you come on up here shortly? I'm here this evening to introduce a very deserving leader. He's delivered tremendous results for us in the HHS world. Gary's a very decisive leader. He stands up for what he thinks right, and we work through that together. He's a former, I don't know if you were ever a former Air Force fighter pilot, but clearly Gary has mastered the ability to lead in dynamic and in a demanding environment. Gary's joined today by his lovely wife, Jackie. Jackie, where are you? Right back at the back. Okay. Gary is the CIO of one of the largest health and human services entities in the United States. Gary joined HHSC in 2004 with a responsibility to transform our HHS IT system into a consolidated system and move us forward and modernize our applications and our infrastructure. Gary leads a technology enterprise that includes the Health and Human Services Commission and 4 other health and human services agencies here in the state. As the CIO of HHS, Gary supports an enterprise with over a $30 billion annual budget. We support 55,000 employees in the enterprise. We have over 1,700 IT staff, and if you compare the enterprise overall, we'd be considered number 80 on the Fortune 500 company list. So fairly significant operation. Gary's organization supports over 400 individual applications, systems and applications for the state as a whole. Over the past 6 years, Gary has successfully worked with HHS business partners and helped to transform the way HHSC interacts with our clients and our citizens. Previously, Texas citizens had to go to state offices, and there's over 300 of those offices. We've partially implemented a new system where applications for services can be taken over the phone, working on the internet through a portal. So we have multi-channel access for citizens to access services. Gary's done that and provided leadership in doing that through taking our current application assets, using service-oriented architecture and utility computing to enable this new functionality at the best value to the state of Texas. Gary has provided unprecedented leadership in setting a vision, goal, and following through with the governance and management where it was needed. HHS has successfully executed major enterprise class initiatives, including a consolidated ERP system for human resources and for financial management. We worked with DIR to consolidate the statewide wide area network and the local area networks. We've just established a very high-level, world-class data center to help HHS meet our capacity needs in the future. And he's created a shared IT services model based on a common data center and application services. With that, I'm very proud to announce Mr. Gumbert as the 2010 Association of IT Professional Public Sector IT Executive for 2010. And I want to congratulate Mr. Gumbert. Thank you, sir.
Thank you very much. Thank you, Bobby. Yes, and thank you all for doing this. This is beyond my wildest dreams. I mean, how do you go from being a fighter pilot to a CIO, much less the CIO of largest health and human services in the country. It was a great honor to get into that position, and I like to say it's been a long journey, but it seems when we were going down the road, it was a very, very long. Imagine going from a jet where you're moving along at Mach 2 or whatever the speed that you're flying, to going to a session where it takes 2 years to get money, and then it takes you 2 years to be able to spend the money. It's if not longer. So the progress is sometimes a snail's speed. But the work that we do at Health and Human Services couldn't be done without the great IT team that was put together. And I feel very fortunate that we've had such a great team. We take care, as Bobby said, the poorest of the poor, the folks who need the help. And with that, it was a great honor, like I said, to be selected to be the CIO. What they didn't tell me when I was selected was I thought I was going there to do one thing, and I found out I was there to consolidate 12 agencies into 5. They kind of sprung that on me the second day. And it was very surprising to learn just how many disparate systems you could have. We had over 800 when we started, and we're down to 400. And it's amazing how long some of these systems and how old they are. And we actually still have FoxPro running for our WIC program, which is the Women's Infant Children program. So FoxPro is a good program. I would like to get off DOS at some point. But we don't want to move too quickly. You know, I think it was Gus Grissom when he was on the space shuttle, or when he was getting ready to launch off the Atlas missile. And I see a lot of people in this room, but I'm the only one that appears to be at this age. Anyway, he was sitting there, and I guess the comment was back, you know, how does it feel to be sitting on the lowest bidder? And, you know, and that's what that rocket was, as he was getting ready to be launched. And sometimes when we're moving out some of our technologies, that's the way I feel. It is the lowest bidder. We do our best to keep it up and running, and it's only through the efforts of folks like Bobby and the commissioner who light the fire under our appropriate part of our body occasionally to keep it moving. It's there again. It's a great honor to be recognized for this today, and I appreciate it very much. So.
Thank you. Again, we are so fortunate to be in this community and have